The fluorescent lights of St. Raphael's Medical Center cast a pale glow over the bustling emergency room. The air was thick with urgency, yet amidst the routine chaos, a moment was brewing that would change the lives of everyone present. "Miss Okafor, I don't have all day," Dr. Harold Whitman barked, his tone sharp enough to slice through metal. He didn't bother lowering his voice. He wanted the entire nursing staff to hear his words, to know who held the power in these halls. His piercing blue eyes locked onto Nurse Amara Okafor, as if daring her to respond. Amara, standing tall despite the weight of his gaze, clutched the patient's chart in her hands. She had worked too hard and too long to let anyone, let alone a man like Whitman, shake her confidence. Still, every word he spat at her felt like a tiny dagger, reopening wounds she thought had healed. "The patient's vitals are stable, Dr. Whitman," Amara said evenly, refusing to let her voice waver. She handed him the chart, her expression calm despite the storm raging within her. Whitman snatched the file and flipped through its pages, muttering under his breath. "Stable, she says," he sneered. "Do you even know what stable means, Miss Okafor?" Amara's colleagues exchanged uneasy glances, their silence betraying their complicity. None dared to speak up, not against Whitman, the revered head surgeon who ruled the hospital with an iron fist. But Amara refused to let him intimidate her. She wouldn't give him that satisfaction. The patient on the bed stirred, his eyes fluttering open for a brief moment. The name on his chart read Robert Walker, but no one in the room recognized him as anything more than an elderly man recovering from a fainting spell. His silver hair was neatly combed, his hospital gown pristine. If anyone had taken a closer look, they might have noticed the subtle signs of wealth, the tailored cuffs, the monogrammed initials, the air of quiet authority. "Is there a problem, doctor?" Robert's voice was soft but carried a weight that demanded attention. Whitman froze, his sneering expression fading into something resembling unease. "Ah, Mr. Walker," he stammered. "I didn't realize you were awake." Robert pushed himself up slightly, wincing as he adjusted his position. His gaze shifted to Amara, lingering just long enough to acknowledge her presence. "It seems I've been awake long enough," he said, his tone measured, "to witness something rather unpleasant." Amara's breath caught in her throat. She wasn't sure whether Robert's words were meant to defend her or merely to chastise Whitman. But the doctor's sudden discomfort was enough to give her hope. Whitman cleared his throat, his arrogance faltering. "My apologies, sir." "Save your apologies," Robert interrupted, his voice firm. "I'm not interested in excuses. I'm interested in results. And from what I've seen, Nurse Okafor seems more than capable of providing them." The room fell silent. Whitman's face turned a shade paler, his mouth opening and closing as he struggled to find a response. Amara's colleagues exchanged startled glances, their unease now mixed with intrigue. Who was this man, and what gave him the authority to challenge Whitman? Amara risked a glance at Robert, her heart pounding. His words felt like a lifeline, a rare moment of validation in a sea of doubt. But she couldn't shake the feeling that there was more to this patient than met the eye. Robert Walker sat upright, his sharp eyes scanning the room, taking in every detail: the sterile walls, the scattered medical equipment, and the uncomfortable silence that followed his interjection. Though his face bore the weariness of age, his presence was commanding. There was something about him that demanded respect, even from the likes of Dr. Harold Whitman. Amara Okafor felt a mix of emotions swirling within her: gratitude, relief, and a cautious curiosity. Who was this patient, and why did his words carry such weight? Whitman cleared his throat, attempting to regain his composure. "Mr. Walker, I assure you, my team and I are fully committed to providing you with the best possible care." Robert's expression remained unreadable. "I've no doubt about the competence of your team, doctor," he said evenly. "But I can't say the same for your attitude. Respect is just as crucial in medicine as skill." The subtle rebuke hit Whitman like a slap. He opened his mouth to respond but thought better of it, nodding stiffly instead. As Whitman retreated to the corner of the room to review the chart, Amara seized the opportunity to check on Robert. She adjusted his fore with gentle precision, her movements practiced and steady. "How are you feeling, Mr. Walker?" she asked, her voice soft but professional. Robert met her gaze, his eyes warm. "Better, thanks to you," he said. After a pause, he added, "And please, call me Robert." Amara offered a small smile, a rare moment of warmth in her otherwise grueling day. "All right, Robert," she said. "Let me know if there's anything you need." Before he could respond, the door swung open, and two men in dark suits entered the room. Their presence was immediately imposing, their expressions somber. One of them leaned down to whisper something in Robert's ear. Whatever he said, it caused Robert to nod gravely. Amara's curiosity deepened. Who were these men, and what was their connection to her patient? Whitman, noticing the men, frowned. "And who might you be?" he demanded, his tone regaining its usual arrogance. The taller of the two men fixed Whitman with a cold stare. "We're with the Secret Service," he said. "And we're here for Mr. Walker." The words hung in the air like a thunderclap. Amara's breath caught, her mind racing. The Secret Service? What kind of patient was she dealing with? Whitman's face turned an alarming shade of red. "The Secret Service?" he spluttered. "Why didn't anyone inform me of this?" The agent ignored him, addressing Robert instead. "Sir, the President has been informed of your condition and has asked us to ensure your safety. We'll need to speak with the medical team privately." Robert sighed, a hint of weariness creeping into his demeanor. "Of course," he said. "But first, I'd like a moment alone with Nurse Okafor." Amara blinked, startled. "Me?" Robert nodded. "Yes, you've shown me more compassion and professionalism today than most people manage in a lifetime. I'd like to thank you personally." Amara glanced at the agents, who gave a curt nod before stepping out of the room. Whitman, though clearly fuming, reluctantly followed suit. Once they were alone, Robert turned to Amara, his expression softening. "I owe you an explanation," he began. "But before that, I want you to know something. Your work today hasn't gone unnoticed. People like Dr. Whitman may try to undermine you, but don't let them. You have a rare strength, and I can see it." Amara felt her throat tighten with emotion. For years, she had endured the subtle and not-so-subtle biases of her colleagues, always striving to rise above it. Hearing these words from a man like Robert was both unexpected and deeply validating. "Thank you, Robert," she said quietly. "But I'm just doing my job." Robert smiled. "And that's precisely why you're remarkable." He leaned back against the pillows, his expression contemplative. "You're wondering who I am, aren't you?" Amara hesitated before nodding. "The thought had crossed my mind," she admitted. Robert chuckled softly. "Fair enough. My full name is Robert Walker, but most people know me as the Secretary of State." Amara's eyes widened. She had heard the name countless times in the news, seen his face on television during diplomatic summits. And now, here he was, a patient under her care. I didn't realize," she stammered. Robert waved a hand dismissively. "Don't worry about it. In this room, I'm just another patient. But out there," he gestured toward the door, "things are a bit more complicated. That's why I value people like you. People who treat everyone with the same dignity and respect, regardless of their title." Amara felt a surge of pride, tempered by the weight of the moment. "Thank you, Mr. Walker. I mean Robert," she said. "I appreciate that more than you know." Before they could say more, the door opened, and the agents re-entered. "Sir, we need to debrief with the medical team," one of them said. Robert nodded, his demeanor shifting back to one of quiet authority. "Of course," he said. Then, turning to Amara, he added, "I meant what I said. Don't let anyone diminish your worth." As Amara watched him leave, escorted by the agents, she felt a renewed sense of purpose. The challenges she faced as a black nurse in a predominantly white institution were far from over, but Robert's words had reminded her of something vital: her strength, her resilience, and the impact she could make, one patient at a time. As the Secret Service agents escorted Robert Walker to a secure room for further evaluation, whispers began to ripple through St. Raphael's Medical Center. The revelation that their unassuming patient was none other than the U.S. Secretary of State sent shockwaves through the hospital staff. But for Nurse Amara Okafor, the weight of this knowledge was even heavier. The atmosphere in the emergency wing had shifted. Amara could feel the scrutinizing eyes of her colleagues on her as she worked. Dr. Harold Whitman, now visibly rattled, maintained a veneer of composure, but his bitterness toward Amara only deepened. His pride had taken a significant blow, and he wasn't going to let it slide. Later that evening, as Amara sat in the break room trying to process the events of the day, her close friend and fellow nurse, Sarah, joined her. "Can you believe it?" Sarah whispered, her voice tinged with awe. "We had no idea who he was, and you handled it like a pro. You're incredible, Amara." Amara gave her a small, weary smile. "I appreciate that, Sarah. But you know how it is around here. All it takes is one misstep, and suddenly I'm unqualified again." Sarah leaned closer. "Then don't give them the chance. Keep being the amazing nurse you are, and let them see who the real problem is." Dr. Whitman. As they spoke, an alert blared over the hospital's intercom. "Code Black. Security breach in Wing C. All personnel proceed to lockdown protocol." Amara and Sarah exchanged startled glances. Code Black meant an imminent threat, and this was no coincidence. The Secret Service had been tense since Robert Walker's arrival, and now the hospital was on high alert. Kindly like, share, and subscribe to this channel for more. Watch out for part 2. Thank you.